And like, when do you pull the trigger to go to a specialist on that?
That's a great question, because ear infections afflict many, many children, and obviously we're in the middle of a cold and flu season, a really bad one actually, so definitely a very relevant question. So we will see patients when they have recurrent ear infections. So if you're having numerous infections over a short period of time, or people forget that when you have an infection and it's a bacterial infection, the first antibiotic may not treat it because bacteria have something called resistance. And so if you're having issues clearing the infection, often a pediatrician will seek our assistance.
And it's a very common thing with kids that need tubes. The problem is sometimes they may structurally be more susceptible to infections, and it may be a sequence of things for a lifetime.
No, absolutely. So, I mean, the ear is a very complex area. That's why there's a whole specialty devoted to it. And there are definitely a lot of predisposing factors, but actually some of the more common things that predispose a child to ear infections can be daycare, obviously family history, and that's where the anatomic issue is, but also just, as we are kind of in the stage now of not being masked and seeing kids start to get exposed to other viruses, a sequence of viruses that are kind of stacked can create enough inflammation to create the blockage of the drainage pathway of the ear to cause an ear infection.
So what other causes what other illnesses would cause someone to come and see an ENT? Would it be strep throat, things like that? Strep throat could be handled by a typical doctor though, right?
So if you have an episode of strep throat, yeah, you're better off going to like an urgent care or your primary care physician. But again, similar to ear infections, when strep throat becomes recurrent and you're having it frequently, that might indicate that the strep or the bacteria may become embedded within the tonsil, where we think that it's becoming more of a chronic infection. So typically when we see patients have like 3 infections a year, 3 years in a row, 5 and 2 years, or up to 7 episodes in 1 year, we definitely want to see them to try to break that pattern of infection.
What might parents not know about an ear, nose, and throat doctor?
So otolaryngology, or ENT, like I mentioned before, it's the best specialty in medicine because we see lots of common conditions that really affect the quality of life of patients. And we see things that are common, like ear infections and sore throats, but other things that I do a lot of infant airway problems. So children that are newborn or premature often can have breathing issues, and that is our area of expertise. We are the masters of the airway in medicine. So if there is a difficult airway, or a patient having some problem with their upper airway, whether it be pediatric or adult, they will seek our help for that, because we obviously can provide some surgical solutions. We see a lot of feeding problems as well, definitely for pediatrics. Nosebleeds, which surprise me how much people live with them and don't realize that there's actually options to not have to live with nosebleeds. And then also head and neck cancer as well. I mean, thankfully more on the adult side, not on the pediatric side, but still, like any mass or lump or bump in a child that's persistent or growing, that would be our jurisdiction.
Yeah, what's the most common kind of cancer for a young child?
So
in the neck?
It can be. There's definitely other types of cancers that are more common, like leukemia and lymphoma. And we can see that manifest in the head and neck with an enlarged lymph node that's growing. Unfortunately, again, with a lot of pediatric tumors, they don't have the morbidity of needing really, really aggressive surgery. A lot of them will be responsive to chemotherapy and radiation. However, any tumor of the head and neck would fall in our realm.
We're just about out of time here, but at what age do you graduate to an adult doctor from a pediatrician?
So at least for pediatric ear, nose, and throat, I'll see patients up to 21.
Really?
Absolutely, but also at our children's hospital, people that suffer from congenital heart disease, or heart disease that they were born with, or some other conditions that you're born with, sometimes we'll follow them for their lifetime.
Charlie, thanks for coming in.
Thank you.
We'll be right back. There's information on Nationwide Children's Toledo Pediatric ENT. We'll be right back.